Hello everybody, today our topic is hyperlipidemia. And first I'd like to ask you, how much do you know about the hyperlipidemia? What's hyperlipidemia? Why hyperlipidemia? How hyperlipidemia? We're gonna discuss about all these crazy things. And now we will talk about a patient who had suffered from hyperlipidemia. The patient is a 15-year-old female who had been admitted to the pediatric ward of the hospital at midday with suspected appendicitis after severe abdominal pain throughout the night. A long history of abdominal pain had been ascribed to a grumbling appendix. A blood specimen taken from the child on admission had the appearance of cream of tomato soup, and after centrifugation a creamy layer was found at the top of the sample. The child's mother indicated that her daughter had not eaten for at least 15 hours, but that she had attended a birthday party the previous evening. But she had eaten burger and chips, followed by ice cream, and had a drink of a milkshake. The child's plasma triglyceride and cholesterol were elevated, which means hyperlipidemia, and electrophoresis of her plasma lipoproteins indicated the presence of large amounts of chylomicrons. The lipoprotein lipase activity in her plasma was low. The child was prescribed a special low-fat diet with increased amount of carbohydrate and protein to provide appropriate energy intake. First, we're going to talk about the lipids normally, then we will concentrate on hyperlipidemia. So, as you know, the lipids are not able to move through the bloodstream without some adjustment. So, to enable their movement, the liver wraps certain proteins around the lipids. The resulting new molecule called a lipoprotein or protein capsule, which can move through the bloodstream. The size of that capsule or lipoprotein determines its density, and the lipoprotein density and the type of apolipoprotein it contains determines the fate of that particle and its influence on metabolism. There are four major classes of plasma lipoproteins, which are chylomicrons, LDL, low density lipoproteins, VLDL, very low density lipoproteins, HDL, high density lipoproteins. And also there is a type between LDL and HDL. We call it IDL, intermediate density lipoproteins, not low and not high. We always hear about these lipoproteins. So for example, what do we mean by LDL cholesterol? LDL cholesterol, commonly known as bad cholesterol, is associated with increased risk of cardiovascular disease. It's also associated with diabetes, hypertension, and atherosclerosis. In a fasting lipid panel, a LDL greater than 160 mg per deciliter is considered abnormal. HDL cholesterol, also known as good cholesterol, is associated with decreased risk of cardiovascular disease. It can be affected by acquired or genetic factors, including tobacco use, obesity, inactivity, diabetes, high carbohydrate diet, and genetic abnormalities, for example, mutations in apoprotein A1. And all these things make HDL cholesterol go down. But as we said, the higher, the better, because this cholesterol is considered a good cholesterol. So less than 40 mg per deciliter is considered a problem. As you see here, the yellow lipids are LDL or bad cholesterol, disrupting the blood flow and causing many problems. The most common types of lipids are cholesterol and triglyceride. And as you know, the body needs lipids to function properly. For example, cholesterol is used for cell membranes, vitamin D, hormones, bile acids, etc. And as we all know that triglyceride, and now it's time to discuss about the hyperlipidemia specifically. So hyperlipidemia means abnormally elevated levels of any or all lipids or lipoproteins in the blood, also known as hyperlipoproteinemia. So when you have hyperlipidemia, you may develop fatty deposits in the blood vessels. Eventually, these deposits make it difficult for enough blood to flow through your arteries. The heart may not get as much oxygen-rich blood as it needs, which increases the risk of heart attack. Decreased blood flow to your brain can cause a stroke and causing many other abnormalities. This condition can be inherited, but it's often the result of unhealthy lifestyle choices, and thus preventable and treatable. Hyperlipidemia can be a risk factor for cardiovascular disease, stroke, acute pancreatitis, etc. Hyperlipidemias may basically be classified as either familial hyperlipidemia, also called primary hyperlipidemia, caused by specific genetic abnormalities, or acquired hyperlipidemia, also called secondary hyperlipidemia, when resulting from another underlying disorder that leads to alterations in plasma lipid and lipoprotein metabolism. Hyperlipidemias are also classified according to which types of lipids are elevated. That's hypercholesterolemia, hypertriglyceridemia, or both in combined hyperlipidemia. Elevated levels of lipoprotein may also be classified as a form of hyperlipidemia. First, familial or primary hyperlipidemia, and this according to Fredrickson classification, there are 5 types. Type 1. Type 1 is further classified into Type 1A, Type 1B, Type 1C. Type 1A, due to deficiency in lipoprotein lipase, resulting in elevated chylomicrons, called hyperchylomicronemia. Type 1B, due to deficiency in apolipoprotein C2. Apolipoprotein C2 plays an important role in lipoprotein metabolism as an activator for lipoprotein lipase. So apolipoprotein C2 activate lipoprotein lipase, while apolipoprotein C1 and C3 inhibit lipoprotein lipase. And this subtype known as apolipoprotein C2 deficiency. And the last subtype, type 1C, due to circulating inhibitor of lipoprotein lipase, this type known as chylomicronemia. Actually, all these subtypes result in elevated chylomicrons in the blood. Type 1 hyperlipidemia doesn't link with coronary artery disease. You don't see increased risk for atherosclerosis because it occurs with LDL deficiency. The main symptoms of type 1 hyperlipidemia: eruptive skin xanthomas, which means irregular yellow patch or nodule on the skin, abdominal colic. Complications: acute pancreatitis. Actually, in most patients, morbidity and mortality is caused by pancreatitis in this type of hyperlipidemia. Also, retinal vein occlusion considered as a complication, steatosis, buildup of fat in the liver, hepatosplenomegaly. In this type, serum appearance will be creamy top layer. Type 2. Type 2 also subdivided into 2 types, Type 2A and Type 2B. Type 2A, known as hypercholesterolemia, because in this condition, the bad cholesterol levels go up in the blood. While the Type 2B, known as combined hyperlipidemia, because in this case both cholesterol and triglyceride are elevated in the blood. So in Type 2B, you will see high amount of both LDL and VLDL in the blood. Hypercholesterolemia caused by LDL receptor deficiency, while combined hyperlipidemia caused by both LDL receptor deficiency and also elevated apolipoprotein B. The higher number of apolipoprotein B the higher risk of cardiovascular disease. Which one is more common, type 2A or type 2B? Hypercholesterolemia is more common than hyperlipidemia. It affects 1 in every 100 people, while combined hyperlipidemia 1 in every 10,000 people. Type 3 familial dysbetalipoproteinemia or broad beta disease. In this type we see intermediate density lipoprotein IDL and chylomicrons are elevated due to defect in apolipoprotein E2 synthesis. Main symptoms are tuberoraptive xanthomas and palmar xanthomas. Serum appearance in this condition turbid, and it affects 1 in every 10,000 people. Type 4 hypertriglyceridemia. We see elevated levels of VLDL in the blood, increased production of VLDL and decreased elimination. It can cause pancreatitis at high triglyceride levels. Serum appearance turbid. It affects 1 in every 100 people, just like the hypercholesterolemia. And the last one, type 5, mixed hyperlipoproteinemia or mixed hyperlipidemia. It's just similar to type 1, but with increased VLDL in addition to chylomicrons. Increased VLDL production and decreased LDL. Serum appearance, creamy top layer, and turbid bottom. All these 5 types are associated with coronary artery disease except type 1. Why? Acquired or secondary hyperlipidemia, also called secondary dyslipoproteinemia. They may result in increased risk of premature atherosclerosis or when associated with marked hypertriglyceridemia. May lead to pancreatitis and other complications of chylomicron syndrome. The most common causes of acquired hyperlipidemia are diabetes mellitus, use of drugs such as thiazide diuretics, beta blockers, and estrogens. Other conditions leading to acquired hyperlipidemia include hypothyroidism, kidney failure, nephrotic syndrome, alcohol consumption, etc.